we're gonna put those to use tomorrow, and you'll need somebody or something to practice your first aid skills on. There'll just be some basic skills, but we'll be using the materials that you've gathered up. We'll be using all of the materials that you've gathered up. So okay.
And what materials?
Pardon?
The materials in their first aid kit activity, is that right?
The first aid kit activity, that's correct. The cravats or the triangle bandages the triangle bandages that will turn into cravats eventually. The tourniquet, the roller bandages, the gauze, I forget what else we had on there. Yes, whatever was on that activity sheet, we're going to be putting to use tomorrow. So it's also going to be a little refresher from your stop to bleed class that you had. You all took that one, right?
Yep.
Mm-hmm.
And would have to use it since then?
Mm-hmm.
Okay.
And that's a good thing.
Yeah, that's good. It's a good thing.
Mm-hmm.
Some chat boxing going on. Rand's trying to learn an iPad for Zoom. How's it working, Rand? Yeah.
Hey, there's Kyle.
It looks like Oregon is connecting. So I'm going to go ahead and sign off, guys. I'll be joining you tomorrow at 12:30, and we'll be doing our activity.
Awesome.
Thanks.
Right. Have a great session today.
Thanks for joining us.
Thanks,
All
Paul.
right.
Yep. Thank you.
Bye now.
Bye.
Hey,
Bye.
hey, Kyle, can you hear me? Kyle?
Kyle, can you hear us?
Maybe they're coming here. You guys see that?
Oh, yep.
Let me see if they're coming in here. Oh, I gotta get my mask on.
Mm-hmm.
Kyle, can you unmute yourself?
Hi, Damian.
Let me. I'm just gonna mute myself for a minute, MJ. I'm gonna go see if those guys are here.
Okay, sounds good. All right. Anyone else have anything fun going on?
All right, I can hear you guys.
Okay. Hey there. Hi, Kyle.
Hi, how's it going?
Good. Real good. So we have Ready Campers with us from Wisconsin and Texas today. And Michigan. Janice, you're from Michigan, right? Yeah. So these are teenagers, anywhere from 13 to 18 years old. So,
All right.
yeah. So you got it, Kyle, then. And
Sorry, I just got this thrown on me, so I'm not for
I
sure
know.
exactly what you want me to go over here.
Oh yeah, if you could just show them the inside of the ambulance and kind of what you have in there and what you do, that would be great.
Yeah. Sorry, I'm on my phone trying to get this worked out here. So we currently have two different ambulances. They're both are set up pretty well equally. So one of the things is that with EMS here in Oregon, we stay pretty busy. We run about together between fire and EMS about 1,700 calls a year. So that averages about 3 to 4 a day. So we have two different ambulances that we try to We keep stock and ready to go at any moment notice. Between our ambulance crew and our fire crew, we can also have EMTs that will help us go on a bunch of different calls. So I can go over some of the equipment that we have if you guys would like to see that.
That would be great.
Oh, fancy machine here I'm turning on. This is called our Zoll monitor, or it's our AED. So basically with this is a big fancy device that allows us to, we can take your blood pressure with this. We can look at your heart rate to how much oxygen you have in your blood. We can also attach a 12 lead, so we can put stickers on your chest to take a picture of your heart to see how your heart is functioning, if it's pumping adequately, to see if there's anything going wrong with your heart as well. Then we can also take a picture of your heart and send it to a hospital to have doctors look at that before we get to the hospital. This also will work is that we have AED pads on here. So if somebody's not breathing, we can hook up pads to it, and we are actually able to charge it, and then we can shock your heart and hopefully get it beating again and put it into the right rhythm. So this is a tool that we use on every EMS call we go on, and almost every call in general, just because it does a lot of different things for us that help make our job easier, and that way it's easier for us to do things, because we can also do it on our machine. So we have it here, and then it sends it into our report for us. So that way we have it for later. But a lot of what we do on here can get sent to the hospital before we get there. So that way they have an idea of what's going on with our patient before we get there. So then if there's anything they need us to do, then they can let us know. Let's see, what else do I got? Tom,
Hey,
are you
Kyle,
still
can
on?
you hear me?
Yeah.
Hey, you know what? You're doing an amazing job, but we just had Fitch Rona show up. So if you don't mind, we'll take a quick tour of their ambulance, just in case they get called out again. Is that okay?
Yeah. Do you want me to stay on, or?
Oh yeah, you can definitely stay on if you like, but we'll switch over and we'll take a tour of theirs because they're here.
Sounds good. You can let
You
them
okay
know.
with that?
Yeah, go for it.
All right, thanks.
No problem.
All right, so you're Casey. Okay. So I don't know. Can you guys all see? So we have Casey here with Fitch Rona, and then I'll kind of turn it over to him, and he can explain. He can explain what they do on a daily basis, and he's got his partner over here, and maybe you guys can. Oh, this is Jesus. Okay, I didn't recognize with the hat on. Yeah. So they can kind of talk about, maybe how they got into the line of work, and then give us a real quick tour of the ambulance. Sound good? All right. So if you just want to, you can take the phone.
All right. Want me to show them the ambulance
You
here?
can show them the ambulance. Yep. Yeah.
All right. Hi, everybody. My name's Casey. I work with Fitch Rona, Pittsburgh and Verona. We'll show you the ambulance here. So I guess just coming around to the outside, we have some of our stuff for trauma right in here. Our longboards, if somebody has a back injury or some type of trauma, a lot of times we'll put them on these longboards just to get them out of the car or to keep their back splintered. We also have a stair chair here. This is just a chair that we can put patients on and carry them down a flight of steps. It has a little track on the back that makes it a lot easier for us to get down steps with them on, instead of carrying them on the longboard or on the cot. Bring you inside here. Did they see any of Oregon's ambulance yet? I don't know if anybody can talk to there.
Yeah, a little bit. Yeah, Kyle was able to show us the Zoll.
Okay. All right. So we have the same deal here. We have the Zoll also. So if you guys already got the runaround on that, we won't show you that. But I think most places, especially in Dane County, have Zolls or other monitors to do the exact same thing. Up here, we have some of our narcotics, some of our medications that we store up there. I guess more important ones or sensitive ones. We also have our bags over here. This is our first in bag. We take this with us everywhere we go. Inside of it here, we just have some basic stuff that pretty much on every call I would say we need. I mean, we have, if I can pull it out, I don't know if you guys can see very well, I'm sorry. We have our oxygen, which obviously we use that on quite a few calls, but just pulling that out. But we also have in the top here a few basic things. So stuff right here just to get their pulse and their oxygen saturation. Just a really, I guess, kind of smaller version of Zoll. It doesn't show, it's all that shows is your oxygen saturation and your pulse. So everything else you need the Zoll for, but it's just nice to get it when we're inside of somebody's house. We don't want to bring the big cumbersome Zoll in there. We also have regular blood pressure cuff and a glucometer for checking people's blood sugars, diabetics' blood sugars. And now with Corona, we carry this everywhere, just a temporal thermometer. We can just swab your forehead, and it'll give us your temperature. So that's kind of our first in bag. We have a few Band-Aids and other things in here, simple trauma stuff. But moving on to our med bag. This is the bigger bag that we carry. I don't know how to change the camera thing on here, so I'm kind of struggling. But how do you change the camera view? Oh, there it is. All right, this is a little bit better. So here's our red bag. This is our bag that basically has everything in it, everything else that we need. We don't bring this in on very many calls, but starting with the side pocket here, this thing has a tablet in it, and we can use that to get we use it for intubation, for getting somebody's airway. If they can't breathe and we need help, then put a breathing tube in. We have a video recorder type of thing that goes down their throat and helps us put that in the proper place. In here, we also have some IV stuff that if we need to start an IV inside the house and we brought this bag in, we can do that inside the house. We have an airway kit. So this has all the stuff to put a breathing tube in someone's throat in. And Jesus will open this up for you and show you a little bit. So it flips open, has all of our stuff in it. So there's one of the breathing tubes that we'll put down someone's mouth if they need it. Nasal airways, just another type of airway device. Oral airway, another type of airway device. All these things just help somebody breathe that can't breathe on their own or is unresponsive. So we're done with that. We got a center compartment here, like I'm sure on the news, a lot of people have heard of Narcan. So we have our Narcan here. A lot of other code drugs that are kind of pre-dosed, so they're simple. We just pull them out and give them. We got some sugar in here for diabetic patients. Just normal saline. Somebody's dehydrated, whatever they need. A lot of patients get that just as a precaution, I would say. And then all of our drugs here. Obviously, I'm not going to go through all of our drugs, but I don't even know how many drugs we have. 60 some?
Yeah, close to 50. Yeah, we can get
50, okay, so we have like 50 some drugs here on the truck that we are able to give with our protocols. I don't know how many paramedics can give, with the national standard, but our standard here, our protocol here in Dane County allows 50 or 50 some. So yep, we have some tubing for the IV stuff. We have a protocol book over here in case we need to just review some stuff or if we're questioning what we need to do. Got a book right here with everything in there. This is our surgical airway kit in case things are really not going well. Instead, if we can't get the breathing tube on them, we can use this to go through their throat and get it that way. That's pretty much our red bag right there. That being said, we have a lot of duplicate stuff. Oh, this is the other part of our bag. Our IO, if we can't get an IV on somebody, we will go through their bone and get an IV that way. We just drill a steel needle. It's the same, pretty much the same size as a regular one we put in your arm, but that one's just made to go through your bone. So we can give all of our medications through there. Any medication that we need, we can give it through the bone if we can't get an IV on them. We also have a PEDS bag right here. It has basically everything that these bags have in it, minus the drugs, just smaller versions for little people, basically. Everyone through that there. We have some extra fluid and stuff up there, and pretty much I would say everything else up here is repetitive out of that red bag. So in here, I can see on TV a lot of times. I don't want to take it out of the package in here, but it's the breathing, so you can give a breath, and you just squeeze this thing. Has some extra masks, things like that. More airway stuff over here. If anybody has asthma, we can give albuterol through this thing. A lot of people have it in inhaler form. This is just basically like a constant.
You know how in ER they have all those different kinds of tubes?
Yep.
They have the same thing. You know, the breathing tubes?
Yeah.
The same amount of them here. They have like 1,000 different ones.
Oh yeah, we don't have like 1,000 of
You
them.
might
I
have
think
had
we
that
have.
at the thing.
Yeah, I think we have like 12 different sizes.
Freezer. Oh my god.
Yeah, so we got just all this stuff is
Understand.
oxygen administration right here. So oxygen mask, put that over. You got one that goes in your nose here. Like I said, nebulizer right here. Different types of nebulizers up here. One that you can hold on to. This one's kind of hands-free, a little bit nicer. I think we use this one 99% of the time. You guys have already seen the Zoll there, so we also have IV stuff right here. Just with we have a couple different types of needles, so we have a lot of them in there. More IV stuff, pretty repetitive from the red bag, I would say. Another glucometer in there, along with our first bag right there. Move on down. We have a cot. I guess another thing here. We have a Lucas device. If I can pull it out here and set it on the cot for you guys. No, come up here and pull this out, Jesus. So this is our Lucas device. So when somebody needs CPR, we have an automated type of a machine that will do the CPR for us. So we place this over their chest, and then so this goes over their chest. Person's body goes right in here, and then this little thing right here just pushes on their chest at 100 times a minute and never stops until it runs out of battery or we push stop. So it's pretty important tool for us. It gives us a lot more opportunity to work on the patient.
They have a machine that does compressions for them.
Yeah.
You know,
so it frees up our hands.
They have a machine that does that. I'm ready. Mm-hmm.
What's that?
They're doing a more advanced tour of the ambulance, and he's showing us a machine that does compressions.
I can't hear him anymore. I'm sorry, buddy. I can't hear you.
I think Daniel was telling his someone in his family about it. So.
Oh, okay. All right. So yeah, we're very lucky to have one of these. We have 3 of them in our department. We're very fortunate, that's for sure, to have one. Put this back in there. In here we have some. So these are splints. So if you broke your wrist. I want to rip that open. Sorry, but if you break your wrist, we'll put your wrist on there. Put your wrist on there. I can't see anything. There we go. I get a text message. Yep. Put your wrist in there and kind of strap it up. Keep it stable. We have those for all of your extremities, your legs, your arms, everything else. So that's everything that's in there. That's another piece of trauma equipment that was outside. Neck brace. We have those outside. We have those pretty much everywhere on the truck as well. Then coming over here, this is all of our trauma supplies back here. So we have huge trauma dressings for big wounds. Sometimes when people get real deep gashes and things of that nature, you got to clean them out if they got stuff from the road in them or whatever it is. So we'll use this. It's just sterile water. Use that. We got everything from those big things all the way down to regular old Band-Aids, the basics. Heat packs, cold packs back here. Got tourniquets and some other stuff that stops bleeding as well. If I can grab one. So if somebody has a really bad bleed, we can just tie one of these around their arm and it stops the blood flow to that extremity so you don't bleed anymore. Oh, so you guys are familiar with all that stuff with the Stop the Bleed course. That's good, yeah. So we have the chest seals, tourniquets, and just more pads that you guys are all familiar with from Stop the Bleed. So that's relatable. Good deal. Awesome. I think that's about it.
Sorry, Tom, I accidentally muted you. There you go.
There we go. All right, hi guys. I'm Casey's partner today. I'm Jesus. I hope everyone's doing well. Thank you for taking some time out of your day to learn about this profession. We're just going to go over the cab and kind of what we do in here. So obviously we have a driver, and then we have the person that is on the passenger seat, which is myself. The way we do it here at Rona and most services do it, the person that's driving is usually the person that's going to drive that entire call. It's going to drive to the call, and then once we get medical treatment happening and the patient's stable, then they're going to drive to the hospital. On the seat that I'm in currently right now, I'm in charge of taking care of the next patient. Okay, so once we transport somebody to the hospital, then we switch roles. Then Casey's going to be up here, and then I'm going to be over there driving. Okay, so that's how we split the calls. Person that takes care of the patient takes care of everything in the back. They go with the patient, right? Do what they need to do, give patient report to the hospital, take care of the report when we come back to the station. I'm going to show you guys kind of how we get dispatched, right? So right now you can see the CAD here. It's a lot. You can see all these units in Dane County are responding to these calls or are on these calls. Okay, so then when we have a call, you know, we can hit responding, or we will talk on the radio. Every call happens on a certain radio channel. Usually for us, it's on Edward when we respond. Depending on what the comm center tells us, we respond on this channel. So, you know, now that's Adam, for example, we can switch channels, and we have plenty of them. You guys see me or no? Okay.
Oh, that's MJ's desktop.
Oh, whoops.
Oh, there we go. There we go. Sorry, guys. So yeah, again, here are kind of our buttons on when we can turn on the lights and sirens when it's really critical, right? Emergency. So this button right now, our lights are on right now. Okay, and then here we can turn on our cue, which will show you, which will be our lights, our siren. You guys hear that? It's fairly loud. Nothing abnormal as regards to a normal truck. That's really what it is. It's just a box mounted on the back. We have our gloves, so we're ready to go when we get on scene. And then again, you know, it's a little bit different between levels, right? So we start at EMT or EMR level, emergency medical responder. Then it transitions into EMT, advanced EMT, paramedic, and then you can even go on top of that and do critical care paramedic. Paramedic is the highest level outside of a hospital. That's the highest level you can get. Usually around our areas and our services here, we have services like Oregon, like other areas that are EMTs or advanced EMTs. And we work together along with them in case they have something that is a little bit trickier for them, or they can't give pain medication. There's certain things that we can do at a paramedic level that they can't, but they do a phenomenal job in stabilizing the patient before we get there. They do the basic stuff, which is what we normally start doing before we do more invasive things. So we work alongside with each other in that way. Here's our air horn. So usually the way we tell people to excuse us, and that's the really loud. That's my favorite part of being a paramedic, to be honest. Here we do have like City Fitchburg map books in Verona. Like Casey said, Rona takes care of Verona and Fitchburg. So sometimes when we're unsure of where we're going, we can check out a map book and see where we're at. We're usually pretty good. We've been on the job a little bit and kind of know our way around. But if we don't know our way around, this little fancy screen here, our CAD, if you hit Get Route, for example, right here, which I'm not going to because it's not our call, it'll tell us on GPS, just kind of like your phone does. It'll tell us how to get there. Any questions on anything about that? No? All right. Thank you. I appreciate your time. Thanks, guys. All right, you guys have any questions before we turn them loose? No? All right. Thanks, you guys. Really appreciate you guys coming out. All right. Thank you. You too.
Thank you. Kyle, could you show us the outside of the ambulance? What's on the outside?
Yeah, I can do that. What we have is a lot similar to what the Rona actually has set up. So as I walk around one of our ambulances here, so most of our people are fire and EMS cross-trained. So one of our compartments, we have oxygen tanks. This is where we can put our fire gear here. I will walk around and show you on our other ambulance that we currently are using here. So when we're on the ambulance, we have our fire gear on here like this because we do fire and EMS. So if we need to, we can go and work as a firefighter, or we can work as EMTs or advanced EMTs if we need to. One of our other compartments is like this. So we have one of those fancy chairs to help get people downstairs, just like what my friends with Fitch was talking about. We have some flashlights in here, some life jackets, and some rope. So if we're ever near water, it can help keep us safe that way. And then we have a shovel, a fire extinguisher, and some other firefighting tools on here. Excuse me. Since most of us are firefighters and EMTs, we have some tools on here that we need if we need to use for a fire as well. As we walk back here to our other compartment, we do have some SCBAs. So these are air bottles that we use if we have to go into a fire or any environment that's not good for us to breathe in. We can put these on to help keep us safe, and that way we're breathing fresh air. Up here, we have some traffic cones that are up here. We have a toolbox. And then we have a compartment here that we can access from inside our ambulance and outside, that we keep some like surgical masks and different extra cot battery and some other extra protective equipment that we can put on. Other than that, on our other side of our ambulance, we have some stabilization equipment. So we have a bag here that we keep a lot of different straps, some C-collars to put around your neck in case if you get hurt. We have some water. And then over here we have what's called our ballistic vest and helmet. So on all of our trucks, we carry bulletproof vests and bulletproof helmets to help keep us safe in any situation that we would feel we would have to put them on or need to put them on for any call. That way we have them on here to help keep us safe as well. And then on our side compartment here, we have a backboard and then a scoop stretcher, which is similar to a backboard, but can come in the 2 different pieces that we can help get somebody off from out of a car, or if a car accident, if they get hurt, or like if someone falls and like would break their hip. That's when this orange or green board would come in handy, just because it comes apart and we can put it on each side of them and then it snaps in together. That way we can help get them off the ground. And then on our last compartment that we have here, it looks like this. So on the bottom part, kind of like what Fitch Rona has, is that they're ready accessible. So we have our bags that we take into the house or to our patients that we use on every call. We have 2 of them, similar to what Fitch Rona uses. They carry a lot of the same equipment like what they do, but we do not carry as much medications and drugs on our ambulance as what they're able to. Up here that we have a car seat. So if we need to transport like a baby or a young child who needs to sit into a car seat, we can either take their personal one out of their home, or we have one here ourselves to put onto our cot. And then up above, we have some more splinting stuff. So we have basically a big inflatable air mattress, kind of like what you guys have, like if you ever go camping. But only we can, instead of pumping and filling it with air like what you normally do, we actually take the air out of it, and that will actually suck into your body to keep it in position, so that way it don't move. And then we also have some splints, like if you break your arm or would break your leg, it does the same thing. Instead of pumping air into it, we actually take air out of it, and it kind of conforms to your body and to your injury, so that way it don't move and it stays in one area for us. So that's a lot of our outside compartments. For example, I can show you inside. It's a lot similar to like what Fitch Rona was showing you. We do have our CAD, can do a lot of the same things that what they already talked about, to going en route to the different calls that are going on right now, to getting turn-by-turn directions if we need to do that. We have gloves in here already, so that way we can put them on as we're going to a call. We have 2 different radios in here, so that way we can be on 2 different radio channels if we need to be, which most of the time we are. And then over here, we have different switches. For example, like this orange one here turns on our emergency lights, and this knob right here is how we work our siren, couple different functions there. And then all these other ones just turn on different lights on the outside of the ambulance or inside if we need to. And then it's just like a normal vehicle the way the rest of our ambulance looks on the inside. So that's the outside, our outside compartments, and then what our cab looks like too. So if you guys have any questions about any of that.
Nice job, Kyle. I think I'm going to owe you another lunch on Tuesday when you're working with us.
Yeah,
It's all right.
that was great. Thank you very much. Does
You're
anyone
welcome.
have any questions? No?
No?
Okay. Do you want to explain, Kyle, what a pulse oximetry is? Because I'm not sure that our ready campers know that. Fitch Rona talked about it, but I didn't want to interrupt them at that time.
Yeah, that's fine. I am going to actually turn on our Zoll monitor here, and I'll put mine onto it. So you guys can kind of see a little bit what we're talking about. So for our pulse ox, for our Zoll monitor here, it's just a little white finger probe like this. That little red light is actually kind of like a little laser. So once you put your finger inside of it, it's actually going to, it takes a little minute. Right now it's actually kind of looking for it, kind of reading it. But basically what a pulse oximetry is, it measures your heart rate. So how fast your heart is beating in a minute. And then it also measures your blood. So your pulse ox would be how much blood, oxygen is in your blood. So once it picks up here, it's slowly starting to read this and make it a little bit better. So right now, so my pulse ox right now looks like it was about 95. I don't have my finger in there all the way, so it's not getting exactly good reading, but normally your pulse ox is anywhere between 93% to about 99% is where we want your pulse ox to be. Anything lower than 93 is when we start looking and thinking about putting you on oxygen if you need to be. Basically, it's a tool that we put on everybody. So we have a finger probe in our ambulance like this that's hooked up to our monitor, or we have a small one that we can basically put in our pocket and we can take anywhere. So if we're inside a house or in the middle of a field or anywhere like that, this can go with us if we want to, or we can take a smaller one that's not connected to anything that will actually tell us the same reading as well. So that's just a little bit about your pulse ox. There's a lot of different things that can influence it. So like if you're cold, or for girls, if you have fingernail polish on, that could give you a false reading or a different reading, just because it's not getting the exact connection to your finger like what it needs. So just a couple different things that could change it on you, in case if you were wondering about that as well.
So Damien is asking, what if it's 100%?
If it's 100%, that's a good thing too. I mean, basically the normal range that you teach you is anywhere between 93 to 100%. We don't really, like, if you're anywhere between that range between your 93 to 100, unless you absolutely need it, we normally don't put you on oxygen or try to raise it any higher, because it can't go any higher than 100%. So 100% is great.
Cool.
And like Kyle was saying, it's just another tool that we use to find out how the patient's doing. So yeah, we can see that they're breathing, but are they breathing effectively to where they're doing it good on their own? Or if they are having an allergic reaction, we can monitor that, and the pulse ox will be like, the number of strokes will drop because the amount of oxygen that's in their blood is starting to decrease because they're having a hard time breathing. So there's a couple of ways that we can monitor that. We can do it with the pulse ox. We can also do it with end tidal. It's the amount of oxygen, the amount of, it hooks up to the nasal cannula that goes in your nose, or there's one that goes on the non-rebreather mask as well. And it finds out based on the air that's coming out, it takes measurements off of that, and we can then tell, it's more accurate as to how well the person's breathing or not. So we can start with a pulse ox, but if we feel like it's not working correctly, we can always go to something else to give us a more definitive answer. It's the same thing like when Kyle was showing the Zoll monitor. We can start out at a 4 lead and just put a couple of leads on the person's chest to see what's going on. And if we feel like, okay, they're in asystole, it's not a big, or they're in normal sinus rhythm, it's not a big deal. Or if you're like, hey, wait, this doesn't look right, then we can put more stickers on the chest to get a really good reading of what's going on with that person's heart. So there's always kind of like a starting, and then we can always move up from there based on how the patient is presenting to us. So all the tools that we use in the back of the ambulance, there's always a starting point, and then as we try to diagnose at our level, we're able to start diagnosing what's going on with the patient by ruling out other things. So if we come across someone that's intoxicated, but we're not sure that they're intoxicated, we have to rule out, other things. They could be diabetic. They could be post-ictal after a stroke, or after a seizure. So those are the things that we have to kind of rule out to find out why we're transporting this first patient to the hospital if we have no idea. So it's kind of like a guessing game. And like Jesus was saying and Casey was saying, when you go up farther into the paramedic level, they're able to give more drugs. So if someone's unresponsive, we can give Narcan. If they come around, then we know that the reason why they're unresponsive is because they had an opiate or a drug overdose. But with paramedics, they can start at the same thing, and then they can just continue to go on until this is the reason why the person's down based on the medication that they gave them. This is how the person turned around. So it's a really fast-paced environment. Especially when you're dealing with someone that is unresponsive and they can't talk for themselves. So great job, Kyle. Thank you very much.
You're welcome.
Anybody have any other questions for Kyle? I'm sure he's got stuff to do. I don't know if you had lunch yet today.
Not yet, but that's all right.
All right.
Okay. Thanks, Kyle. Thank you so much.
You're welcome. Thanks for having me. Have a good day.
Yeah,
Yep.
thank you so much.
Like I said, I'll get you lunch on Tuesday.
Okay.
All right. Anyone else have any questions at all? Okay. So, you know what to have prepared for tomorrow, right? Yeah. Damien says that is cool that you can do that. For a second, I was confused because I saw Tom talking, but Kyle's video was showing. Yep.
Oh.
That's true. So, all right. Okay, well, we'll join tomorrow then at 12:30 and have your first aid kits ready, okay? And
All right, perfect.
do some first aid at home.
You guys have a great day.
All right, thank you.
See you guys.
Bye. Bye, everyone.